wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. And I want to ask you a question. What is your skin trying to tell you? I want to keep this very relevant. Our topics here are usually related to what we get a lot of inbound calls about at Physicians Preference Pharmacy. And just yesterday, I got 3 separate calls about 3 separate patients about eczema. So this is why I want to discuss it with you today. Over the past 4 or 5 years, I personally have seen a huge uptick in the rates of eczema. And I would say also that they're becoming more treatment refractory, meaning that patients have tried many things. They've tried the biologic drugs, which alter the immune system. They've tried the topical creams. They usually have gone through many rounds of steroids, oral steroid medications, or topical steroid creams, which usually work for a little bit and then come back with a vengeance. So I want to peel back the layers on eczema, explain what it is, explain how it's different from some of the other skin conditions that we might be seeing, and then also provide a solution, of course, here at the end. So eczema can show up for a lot of different reasons. Essentially, eczema is an extreme sensitivity to certain triggering substances. So that can be soaps, it can be pet dander, it can be the fabric in your clothing, it can be various medications, it can be a result of vaccinations, it can be a result of high spike protein levels from the COVID-19 virus. I see a lot of that too. So when we have spike proteins that are lingering, which is a part of that virus and what it gives off and can stick around in the fat tissue and in the central nervous system and the nerves and the muscular tissue, it causes a lot of inflammation. And so one of our approaches is to get those spike protein levels down to decrease inflammation. And our approach is 2-pronged. One, we want to remove the offending agents that can be causing the eczema or worsening it. And 2, we want to provide some relief. Because as a pharmacist, one of my main concerns here is what we call secondary infection. So our skin is our largest organ, right? It helps to protect us against the bacterias and the viruses and the fungus and all that stuff that lives on the surface of our skin that should be there. But if we have breaks in the skin or tears in the skin or the integrity of the skin barrier is weak and starts to break down, then we may be getting leakage through the skin barrier with direct access to our bloodstream, and we do not want that. So we're always very concerned about that secondary infection, which is why we have to be sure that the barrier of the skin is strong and keeps the good stuff in and the bad stuff out. So a lot of people with eczema will have intense itching. I actually see this a lot in kiddos. Their parents are obviously very worried because they're getting disruptive sleep. I've heard that it's so bad that their kids cannot go to school. It's very difficult for them to focus and concentrate because they're so itchy, and it's almost impossible for them to not itch. And then when it becomes flaky and falls off again, that's when we become very concerned about that potential infection. So there are some differentiating factors between eczema and some other derm issues like psoriasis, for example. So if you're wondering if, do I have this? Maybe you haven't been to the doctor yet. Maybe you're concerned about the appearance of your skin. Here's a few things you may look out for. So the dry, itchy skin, that can, again, be caused by illness, irritants, allergens, or stress. We do see that it's more common in babies and young children than some other conditions like psoriasis, for example. Having red, dry, cracked skin also presents usually on the face, the scalp. I oftentimes will see it here kind of at the base or the nape of the neck in the hairline, also on the front of the neck, and then the wrists and the ankles as well. Some triggers can be external, again, like pets or dander, and some can be internal, where we think that it's more immune system related. And the treatments can be either oral or topical creams. So with eczema, what we want to do is, when we're trying to come up with a good approach to making the symptoms lessened, and we're talking about topical options, we want to first address the pain and the itching. We also want to be sure that we're stabilizing the immune system so that the immune system is not overreacting. As with any dermatological or skin-related issue, typically, remember, this is a manifestation of what's happening on the inside. The body is saying, oh my gosh, this is a cry for help. Please, you're not listening to me though. Something is bothering me on the inside, so I have to show you on the outside. So for us to be able to stabilize the immune system is a really important component of our overall approach to healing for eczema. So I want to share with you a formulation that is proprietary to Physicians Preference Pharmacy that we developed about 5 years ago, because that's when we started seeing the uptick in eczema diagnoses for both adults and kiddos alike. So this specific formulation contains ivermectin, naltrexone, zinc pyrithione, and hydrocortisone. And this is a topical cream. Those are the active ingredients that we use. And there's a reason why we use that blend. We oftentimes will have our patients on a combination of oral therapy as well. So oral capsules, usually involving low-dose naltrexone to stabilize the immune system and to decrease inflammation, because this is also largely inflammatory driven. And also amlexinox. Amlexinox is a steroid-like medication that we also compound, but it does not give the same effects, the same side effects as steroids. So amlexinox does not exhibit the same side effects as high-dose steroids, which those with eczema are oftentimes dependent on steroid treatments or steroid cycles frequently, which can really, really negatively impact the immune system. We don't want that. So the ivermectin that's present in this topical formulation ivermectin is actually approved for both rosacea and scabies. A lot of people don't know that. So it's available as a topical cream. I think I looked up the prices yesterday and it was somewhere around $700 a tube. And that's very expensive. So it's very difficult for people to be able to afford that. We're using just a little bit of ivermectin in there combined to help decrease inflammation and give that structure back to the skin tissue to keep that barrier strong. Also, the low-dose naltrexone that I talked about, we put a little bit of that in there to support the immune system and to decrease the itchiness that is so bad with eczema. So we like this cream because it works quickly for people as well, for quick relief. It's got zinc pyrithione in it, which naturally works as an antifungal and an antibacterial. So if we already have that compromised skin barrier and we're already seeing some of that potential leakage of viruses and bacteria through the skin, we want to discourage that, of course, keep the skin healthy. And then lastly, we have hydrocortisone. So just a little bit of hydrocortisone. Also note that this preparation can be made hydrocortisone-free, especially for kiddos where their skin barrier is a little bit more thin. And so one of our considerations would be that we don't want too much to get absorbed through the skin, especially in our younger population. But of course, that is the classic corticosteroid that helps to kind of calm the inflammation and the overreaction in that area. So if you are concerned, if you may have eczema, if you've already been diagnosed with eczema, or if you're struggling with eczema right now, if you know someone that has eczema, please share this information with them because it is highly relevant right now. And we would be happy to discuss more with you about what is in our formulation, how we came up with it, and how we can be sure that we can get those eczema symptoms under control for the long haul. So please do give us a call. You can speak with any one of our pharmacists at Physicians Preference Pharmacy by calling 281-828-9088, and it would certainly be our privilege to serve you. At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom-made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physicians Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes,
and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.